Hello, and thanks for joining us today for the webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Judith Sears-Poisson, and I'm happy to be your host today. Our webinar is on approaches to reducing administrative burdens in accessing and maintaining services from government agencies and public programs. And we're fortunate to have four great researchers with us today. First, we'll hear from Dr. Meredith Dost, who is an IRP National Poverty Fellow in residence at the Office of the Assistant Secretary for Planning and Evaluation in the U.S. Department of Health and Human Services. She'll discuss her work on the mass political implications of Medicaid administrative burden. Next, we'll turn to Dr. Elizabeth Bell, an assistant professor in the Lyndon B. Johnson School of Public Affairs at the University of Texas at Austin. She'll share her research on how bureaucrats' capacity and staffing of navigator positions, like school counselors, may be an important tool for burden reduction and increasing access to public benefits for marginalized communities. And then we'll hear from Dr. Carolyn Barnes, who's an associate professor in the Crown Family School of Social Work Policy and Practice at the University of Chicago. She'll draw on several qualitative studies to analyze the psychological, compliance, and redemption cost factors that contribute to administrative burden. She'll also share an overview of what agencies can do to reduce burdens from workers' perspectives and the role of third-party actors in creating burdens for beneficiaries. But first, we're fortunate to have Dr. Donald Moynihan here to set the stage for us. Don is a professor in the Gerald R. Ford School of Public Policy at the University of Michigan. With Dr. Pamela Hurd, he literally wrote the book on this topic, Administrative Burden, Policymaking by Other Means, which was published by the Russell Sage Foundation in 2018. We'll drop links to those papers and to the book into the chat during the webinar so you can find them easily. This webinar is supported in part by funding from the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation. But views expressed by our speakers don't necessarily represent the opinions or policies of that office or of any other sponsor, including the University of Wisconsin-Madison. We have an hour today, and after we hear from each of our presenters, we'll spend the last 15 minutes or so at the end for a live Q&A that Don Moynihan will moderate. You can type questions into the Q&A box. We did get quite a few questions submitted as people registered, so we'll also be queuing some of those up as well. I hope you'll feel free to participate through the chat and let us know who you are and where you're joining us from. And I do want to let you know that we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. We'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. So with that, thank you again for being here, and we'll get started with Professor Moynihan.
Hi, everyone. Thank you for joining us today. It is terrific to see, at this point, more than 300 people sign up for a webinar on administrative burdens. Who could have thought that was possible? Pam Hurd and I started working on this topic around 2010 when we were faculty at the University of Wisconsin-Madison, and our engagement with IRP at the time was formative in helping us to think through some of these problems and issues. And what we figured out during that time was that a lot of people experience frictions in their everyday lives, but we didn't necessarily have a broad language to communicate that to policymakers or to pursue research based on those themes or experiences that we might have. And so we set out to try to create that. We defined administrative burden as people's experience of policy as onerous. And then we've defined different types of costs that people could encounter as they interact with policy implementation. These are learning costs, compliance costs, and psychological costs. And our goal here was really to think about ways in which we could construct research frameworks, concepts, and language that would allow different groups to communicate to one another. These include researchers from different disciplinary backgrounds, and we're going to see some of that today, people with different research approaches, but also beyond academia, our ability to communicate to policymakers and administrators who are working in the front lines of government. The claims we established in our book emphasize that small burdens can sometimes have very large effects when it comes to accessing services, that burdens themselves can be a source of inequality. That is to say, people who might most need help from government might struggle the most to overcome the administrative barriers in order to get that help. And then third, the burdens are constructed, sometimes deliberately so, sometimes because governments have stopped paying attention to the negative externalities they're producing through administrative requirements. The good news from that point is that if burdens are constructed, they can be reconstructed in ways that make it easier to access public services. And so much of the research around this topic now, I think, is highlighting ways in which burdens are experienced, but also giving suggestions to policymakers about how burdens can be reduced. And I'm especially heartened to see so many people who are actually working in government joining today's talk. We have three tremendous researchers who've already been introduced. I'm not going to reintroduce them. I'm looking forward to the Q&A. Just a warning, I think we had something like 8 pages of questions submitted. So I'm going to try to get through as many as I can and maybe consolidate some. And I expect we're going to have a very rich conversation. But right now, I want to hand over to Meredith so she can start her presentation.
Great, thank you very much, Don. Just share my screen. All right, so I'm very excited to share the highlights of my paper on the mass political implications of Medicaid administrative burden and its implications for policy design and government program administration. While interviewing means-tested program recipients about their experiences applying for Medicaid and other programs, I had an illuminating conversation with a middle-aged couple in Evansville, Indiana, a city of about 100,000 people. The woman told me there are lots of hoops to jump through just to stay enrolled in Medicaid coverage and other benefits like food stamps. They explained how it's hard to keep up eligibility and they have to show lots of documentation in paper form every time. Now, these complaints about means-tested program administration are not unique to Evansville, though, as I will show, the details vary across place and time. The paradigm that I'm advocating for is that people's interaction with the government impacts their willingness to engage with the government in the future. This is a core tenet of policy feedback theory. So my paper studies the downstream political effects of ordinary experiences with program administration, otherwise known as administrative burden, which I'm not going to define as Don just gave us the definition on it. So I assert that these lived experiences with government program administration are important because their outcomes deeply affect the lives of those who rely upon them. So prior research on policy feedback effects have sometimes concluded that there are positive effects of being a government program recipient on things like political efficacy and participation, whereas other studies have concluded that there are negative effects. And really, the direction of the effects depends on the policy and the specific context itself. However, I argue that there are some limitations to these studies. They tend to either examine the simple receipt of a program or they examine the administration of a single program in one narrow geographic location and in one snapshot in time, which assumes consistent levels of administrative burden. There's also work that examines the mass level policy feedback effects of Medicaid expansion, which created a new population of eligible citizens in some states. And that work finds small positive effects on voter registration and turnout. So in contrast, I'm examining the mass level political participation effects of the intricacies in the variation in the administration of one program, Medicaid, in all states and over time. I demonstrate that administrative burden is a mechanism through which policies shape politics. My research question is, how did the administrative burden of Medicaid impact mass level voter turnout in national elections in the aftermath of the implementation of the Affordable Care Act? My expectation is that greater Medicaid administrative burden caused a decline in voter turnout. And the logic underlying this is that interactions with the administrative state or their spillover effects on the mass public influence attitudes about the government, the program, and its recipients, as well as political efficacy. And all of those things affect the likelihood of voting. For the sake of time, I'm not going to go into any more detail about my theory, but I encourage you to read about it in the paper, and of course, happy to discuss it in question and answer if there's time. So why do I focus on Medicaid? It meets a basic need, providing health coverage for people without health insurance. It's a joint federal-state program administered largely by the states, which creates great potential variation in its administration. And then with the Affordable Care Act, or Obamacare, passed in 2010 and implemented in 2014, this kind of was a shock to the administrative burden of Medicaid. It provided the option, after the 2012 Supreme Court decision, for state Medicaid programs to expand to individuals who made up to 138% of the federal poverty level. It also required all states to streamline enrollment and renewal processes, and this was regardless of whether states opted into the expansion. In addition, Medicaid is a highly visible program, very traceable to the government. About 1 in 5 Americans are currently enrolled in Medicaid, and about 2/3 of the public has been or is a recipient or has had someone close to them, like a close friend or family member, on Medicaid, according to Kaiser Family Foundation polls. So now for how I actually measure Medicaid administrative burden. So I collected 31 indicators of Medicaid administration, all of these listed here, in every national election year from 2010 to 2020. And I collected this from the Kaiser Family Foundation annual reports on state Medicaid programs, other Kaiser publications, and also the Internet Archive. But based on my interviews with means-tested program recipients, I ensured that the key pain points they mentioned were reflected in this measure. So for example, something I heard over and over was about the ability to upload verification documents online rather than having to bring them in person. That made a big difference for folks. And also the existence of work requirements and their associated reporting. So I added up all of these 31 measures, scaled them from 0 to 1, with 0 being the lowest burden and 1 being the highest burden. So to demonstrate that Medicaid administrative burden has indeed varied over my time period of study and across states, I'm presenting the plots of my administrative burden index in different snapshots in time. So darker colors indicate higher burden, whereas lighter colors indicate lower burden. And so here we see, starting in 2010 and 2012, pretty much across the board, the maps are pretty dark, indicating high levels of Medicaid administrative burden. However, we can already see some variation across the states. And then we start to see some states with stripes on them, and the stripes indicate that that state had expanded Medicaid in that year. And we start to see just over time a general lightening of this map as Medicaid administrative burden decreased on average, but there's still a lot of variation across the states. And even in 2020, there are states that still have a relatively high level of Medicaid administrative burden. To identify the effect of Medicaid administrative burden on voter turnout, I utilize a generalized differences in differences design, and I examine county level voter turnout, again, in these national elections between 2010 and 2020. I use only border counties that are within 100 miles of the border with a neighboring state to focus on changes in participation at state borders. And the main intuition underlying this approach is that changes in voter turnout for counties with small changes in Medicaid administrative burden are a good counterfactual for changes in turnout for counties with large changes in Medicaid administrative burden. And this is conditional on lots of pre-treatment covariates, things like county level demographics and political variables. And importantly, I also control for Medicaid expansion status, as well as several measures associated with the administrative burden of registering to vote and voting itself. So the paper has a lot more details about the measurement of electoral administrative burden, which I won't have time to go into in the presentation, but again, encourage you to take a look. Okay, so now showing you the results. This coefficient plot displays the effects of Medicaid administrative burden on turnout across 2 different model specifications and 2 different two-way fixed effects estimators. So just generally here, you can see, there's a consistency across the models. And now interpreting just one of these, the classic two-way fixed effects estimate that includes all covariates, we see that the effect of a county having the highest Medicaid burden level, which was an index value of 0.77 out of 1, versus the lowest burden level, was a decline of about 1.37 percentage points in turnout. Now, given that those most likely to be significantly touched by Medicaid administrative burden are the same low-income citizens who vote at pretty low rates, it's not surprising to find small but significant county-level turnout effects. And this difference can affect electoral outcomes in the context of contemporary American politics. And of course, any discouragement from participating in democracy is concerning. So these results indicate that lived experience with government program administration is a critical pathway through which policies can shape political participation. So what can the government do to reduce these administrative burdens? Well, my research indicates that the government should shift the burden to the state as much as possible and away from individuals. The approach to actually doing this kind of depends on the level of government. So at the federal level, this can be done at the policy design stage by requiring streamlining of enrollment and renewal processes, just as was done for the ACA. And the policy itself could also require federal oversight of significant state or local administration decisions. And so this graph here shows my Medicaid administrative burden index measure over time. And you see that the vertical dotted line is 2014, which is when the ACA went into effect, requiring, states, among other things, to streamline their enrollment and renewal processes. And we see that the ACA was actually really effective in decreasing the average Medicaid burden level. So there's definitely hope there, again, at the policy design stage. At state and local levels, my results indicate that all the indicators kind of included in my index that affect the user experience do matter. So states could make the user experience easier by, say, having an online application that's mobile friendly, having the ability to upload verification documents online rather than bringing them in person, lots of other kind of user experience focused decisions. So thank you very much, and I look forward to the question and answer. And now I believe I'm turning it over to Elizabeth.
Thanks, Meredith. Let me share my screen. Okay, so thanks everyone for being here. As mentioned, I am a professor at the LBJ School, but also I'm an academic affiliate with the Office of Evaluation Sciences. And I mention that because I will be talking about both the work that I've done as a professor, as an academic researcher, but also some of the work that I've done with the Office of Evaluation Sciences in GSA that's really trying to use quasi-experimental and experimental designs to reduce burdens and specifically improve user experience and ultimately, hopefully, improve things like racial equity. Now, I'm trying to make sure everyone can see the full screen. So let me go ahead and share. There we go. And Judith, can everybody see the full screen now? Okay, great. All right, so the motivation for all of this work today, I'll be thinking about, the impacts of burden reduction strategies on equity and program access. So as Don mentioned at the beginning, administrative burdens, they create these really stark disparities in program access for marginalized communities. So the learning, compliance, and psychological costs are not felt equally across different members of the public. They disproportionately impact marginalized communities. Some of the communities that I've been interested in researching are people with disabilities, racialized groups, low income, students, non-cisgender folks. And ultimately, we know that this creates some really big problems in terms of access to public programs whose design and goals are to actually uplift those marginalized communities. So this is a really big problem. And a lot of folks in the federal government, state and local governments are thinking about how we can actually move the needle in terms of reducing disparities. So that's what I'm going to be focused on today. So this is a new framework that just came out, thinking about the different types of strategies we may be able to use in order to reduce disparities and also ultimately reduce administrative burdens more broadly. So as part of my role with the Office of Evaluation Sciences, I've been doing a lot of RCTs around communications. So one of the key barriers at the very beginning of an application process is, do people even know that they're eligible for a program? Do they know the program even exists, right? And so a lot of these behaviorally informed communications are thinking about better communicating and respecting the public. Now, ultimately, across multiple different behaviorally informed communications interventions, our findings generally show that you can increase program access by around 1 to 2 percentage points. But what I want to draw attention to here is that oftentimes we find that we are moving the needle not for people most at the margins, right? And that's a really important limitation, I think, of just relying on communications interventions. Now, in addition, we've also been thinking about how can we discard administrative burdens, right? How can we actually, for instance, going back to Meredith's ideas about Medicaid documents, how can we reduce the number of required documents, especially if there's some redundancies there? And ultimately, I've done an evaluation of discarding and simplifying. And in some cases, this can increase access for underserved communities. For instance, I looked at women-owned businesses, minority-owned small businesses, and businesses owned by people with disabilities during the COVID-19 pandemic. And ultimately, discarding and simplifying the application process did actually improve access for those communities to these relief funds during COVID-19. But we found ultimately non-underserved businesses were better able to take advantage of that program after some of those burdens were discarded. And so without actually communicating well with the public, even discarding burdens could actually intensify these administrative burdens and not reduce disparities. So those are two sort of opportunities to think about different strategies and two efforts that we've engaged in that frankly haven't actually reduced disparities. And that's really important, I think, for us to be thinking about. However, one of the strategies that I think across multiple different communities of researchers shows the largest and most meaningful effects for marginalized communities is this strategy of sharing and investing in personalized assistance. This is what we would consider a high-touch intervention, right? That's really trying to provide personalized assistance to applicants going through these different processes. Now, one of the problems we know right off the bat is that access to this personalized assistance is stratified. And I'll get back to that in just a moment in this particular context. And we argue that this is really critical. Access to personalized assistance may be critical for reducing burdens and ultimately improving equity and reducing those disparities. Now, I'm going to show you some evidence from a particular empirical setting, thinking about the number of counselors. So a research question is thinking about how increasing the number of counselors that provide personalized support to students can potentially increase students' access to burdensome, means-tested financial aid programs for college. And I'll show you evidence for both the federal Pell Grant and also for a statewide tuition-free promise program in the state of Oklahoma, which is even more burdensome than the FAFSA application, which I've already seen some questions about in Q&A, that is notoriously very burdensome. Now, we're looking at this specific school counselor policy because we're predicting that increasing the number of school counselors would actually disproportionately benefit low-income students of color by reducing the need for counselors to triage and only serve some students and not serve others. And in addition, improving access to assistance for those in need, right? Most in need. The problem that we have across our schools in the US is that there's too few counselors. The Biden administration has actually tried to strategically invest in expanding the number of school counselors. But nationwide right now, what we have is a national average around 491 to 1 in terms of the student to counselor ratio. The ASCA actually recommends a 250 to 1. So we still don't have enough counselors for every student out there. And most importantly, I mentioned that it's stratified, right? So Black students and low-income students, they're the most likely to attend a school that doesn't have a single school counselor. So what we're doing in this paper is we're thinking about, evaluating a specific staffing policy that mandates a 450 to 1 student to counselor ratio. And we are actually conducting a regression discontinuity that leverages this specific threshold. And we're going to compare schools that are just above that student enrollment threshold to schools that are just below the threshold to see if hiring an additional counselor actually does move the needle on program access for students to these two big, burdensome, means-tested financial aid programs. And ultimately, the takeaway is that additional counselors do improve access to these burdensome financial aid programs for both the federal Pell Grant and for Oklahoma's Promise. And we're looking at Oklahoma because this is where I have really rich administrative data, right? And as opposed to what I was talking about earlier in terms of our average effect size for behaviorally informed communications, I mentioned it's around 1 to 2 percentage point increase in take up, usually not among people who need help the most. Increasing, going from say 1 counselor to 2 FTE counselors increases the percentage of students accessing the federal Pell Grant by around 32 percentage points. And for the Oklahoma's Promise, it's a smaller effect size. There's ultimately a lot more outside of the counselor's control. But compared to a behaviorally informed communication intervention, we see much larger effects, right, of personalized assistance. And most importantly for this case, we find that the effects are entirely driven by low-income Black, Hispanic, and Native American students. In fact, the effects are completely null for white students who might, right, otherwise have support in this process. So we do find that in this case, right, increasing the number of school counselors meaningfully increases program access to these two really burdensome financial aid programs. And to conclude, I just want to have a broader conversation about how we can think about different burden reduction strategies. So, I presented to you the limitations of communications interventions. They are really feasible politically and economically. Most in need. Even discarding burdens can actually widen disparities if it's not paired with other attempts to intervene in the information phase to make sure everybody knows that the program exists. Now, I do think that personalized assistance consistently across different studies has actually been shown to increase equity in program access by helping those most in need. And this is the case also for other studies, for instance, on FAFSA completion. Most of the scalable nudges, when they're taken to scale, have very small or null effects. But when you look at the personalized assistance interventions, they have very large impacts. And also for students who really need help the most. Now, in the future, I'm looking forward to thinking more about psychological costs and how trauma-informed practices and training for frontline workers can actually improve and restore trust in government and reduce psychological costs. And just to set Carolyn up for her presentation, I think that we also need to be investing a lot more in diagnosing the root causes of burdens before we select the solutions that we're going to try and the strategies that we're going to employ. And I think Carolyn has done some of the best work to help us diagnose these sort of root causes of administrative burdens. So thank you so much. Feel free to reach out if you have any questions, and I'll pass the baton over to Carolyn.
Thanks, Elizabeth. And thank you everyone for being here. I see all these great questions from administrators. So y'all are actually the experts on how these programs run and the problems that you see and some of the barriers that the folks that you serve might be experiencing. So I feel like today I'm going to be preaching to the choir. And I do hope that it starts a really good conversation about what we can do to reduce burdens for folks. Let's see, hopefully I get this right. Okay, I think I did that right. All right. So I'm going to present some qualitative evidence over a few studies that myself and a team of researchers have conducted in the past, I guess, going on 9 years. Good Lord. Basically trying to give a snapshot of what people experience on the ground and what might be some effective ways of reducing administrative burden for folks. So based on the questions that were submitted before the webinar, I kind of put a bunch of them in little buckets and summarize them as, being like, what contributes to administrative burden at agencies, and then what makes using benefits difficult. There were a couple of questions about housing. Some of the insights about the difficulties of using benefits is related to housing, but also Medicaid, nutrition assistance, and childcare. So I'm going to provide some insight on that. Again, this is from 3 qualitative interviews, and it's drawing from some hunches that we have based on 600 plus interviews of workers and beneficiaries across 3 states. The 3 states include Pennsylvania, Kentucky, and North Carolina. So what we've concluded over the years as to what contributes to administrative burden within agencies, this is no new news to you, you managers here and administrators that are here, is administrative capacity. You can only do so much if you're facing some funding constraints at the state or the county level. You can't hire more workers to provide that personalized assistance if there isn't funding to do so. And this is no news to you as administrators, but it can sometimes be challenging for academics like myself or advocates to wrap our minds around. So the federal government only covers about half of the administrative costs for federal programs like a SNAP, like a Medicaid, which means that states and counties have to come up with the other funds to strengthen and support the capacity of the workforce. So when we've done interviews with workers across states and WIC, SNAP, and Medicaid in particular, that's what's highlighted. There are some serious constraints in terms of funding. And when there are fewer workers, there's higher compliance and psychological costs for beneficiaries. I don't remember if we defined what those costs mean. So, and I might be forgetting, Don, and I'm sorry. Compliance costs basically mean the forms that you have to fill out, the things that individuals have to do, the information they have to provide for the worker to determine that they're eligible. Learning costs is, do you even know about the program? And then psychological costs is the stress and stigma of the whole thing. And when we have more workers that can provide that personal touch, we know that those things potentially can decline. And in terms of administrative capacity, I think we've got some pretty good compelling evidence that the COVID demand for benefits outpaced the capacity of agencies. So even in sort of a once in a lifetime crisis where we see an incredible reduction of administrative burden, if you don't have that administrative capacity to meet needs, you're still going to see psychological costs for claimants. You're still going to see folks being stressed out because they can't reach their worker. You're still going to see folks stressed out because they're experiencing delays and denials with their benefits. In addition to administrative capacity, one thing that's come up time and time again is how agencies measure performance. And again, this is no news to the folks that are on the call. This is determined by the federal government, but it's enhanced by state and county agencies. So for SNAP and Medicaid, there's an emphasis on timeliness and efficiency. For WIC, for the WIC directors on the call, there's the emphasis on recruitment and retention. And we find that shapes workers' behaviors towards clients. With benchmarks that are oriented towards recruitment and retention, it yields some psychological benefits, like not costs, which is really cool to see that we can actually see some psychological benefits where WIC participants, for example, are reporting socially supportive interactions with workers. And childcare beneficiaries are reporting these positive, supportive interactions with workers. And that's in part because WIC emphasizes customer service, and the money follows the cases, and workers are encouraged to have that personalized touch. But benchmarks that push caseload reduction, accuracy, and efficiency, we find, tend to increase psychological costs for beneficiaries. So there's a lot of good evidence on TANF and how caseload reduction pressures created a really difficult program for beneficiaries to access. And there's some newer evidence about the role of these accuracy and efficiency benchmarks for SNAP and Medicaid, qualitative evidence that suggests it leads workers to cut those personal interactions short, it leads workers to focus on processing the cases above that personal touch social service delivery. And I have some evidence that I'll share with you today that shows that. And then complicated policies in general constrain workers from meeting the benchmarks, which can create more issues and challenges for beneficiaries that are trying to access programs. And again, this is not new news for the administrators on the call. So here's an example of a SNAP and Medicaid worker that's touching a little bit on this, the pressure to perform in addition to the limited capacity. So this SNAP worker, these two workers are from North Carolina. This SNAP worker says that she viewed her work as overwhelming and worried about falling behind and getting into trouble with the state. So she goes on to describe her caseload and all the things that she has to do and how she feels rushed. So she says, a good average would probably be 90 to 100 cases a month. This is her caseload, and we have to process that within 30 days. And then we have to do the changes. We have the phone calls. We have to come see clients. So it's a lot. So sometimes it's overwhelming. And if we don't get it done, we're going to get into trouble. And the trouble they're talking about is corrective action. And of course, we all want our records to look good, but sometimes I just feel rushed. Like I have to do these things in a certain amount of time. So she's focused on processing her cases within those timeliness deadlines, and some counties ratchet those timeliness deadlines up. So it's not really 30 days, it's 25 days or 21 days, depending on which county you're in and which agency you're in. And that takes her away from having the time and the energy to devote to the personalized touch that a SNAP claimant or a SNAP applicant might want. And this Medicaid worker, she makes a connection between the stress of meeting the deadlines and her feeling disconnected from her clients. So she says, sometimes I don't feel like I help people because I just stay busy. I feel like I'm pushing numbers, pushing papers, keying all day long, just frantically trying to get it done. Sometimes I don't know who I'm helping. So again, sort of demonstrating how it's the performance benchmarks, and then on top of that, just having a caseload that's probably outpacing the capacity of the agency and certainly the capacity of the worker, that leads them away from more personalized service delivery. And for WIC, it's the opposite. Because WIC funding depends on the caseload, it expands with the caseload. WIC, as the WIC directors know, the program incentivizes caseload recruitment and retention. They really work to keep people on the rolls. And this particular WIC worker is commenting on the connection between caseloads and funding. She said, there's been a decline in this particular county, and it's been happening for the last 5 years. And so if the numbers go down, so will the funding. The state will cut the funding or the program. And so they haven't been able to really hire more staff because of that. So there's this threat of declining funding, not being able to have additional staff at the agency, at the clinic. And that's really top of mind. And because it's top of mind, workers are spending a lot of time doing outreach to community organizations, and they aim for flexibility and accommodating WIC participants' schedules for appointments. So she goes on to say, outreach is going on. It's being conducted regularly now, like mandatory, because the main thing is to bring the numbers up. So we're not talking about processing folks quickly or making sure it's super accurate. We're talking about bringing the numbers up for WIC. And this is how this is experienced from the beneficiary's perspective. So for this WIC client, she emphasizes, when she's describing her program experiences, the staff's flexibility and the customer service she experiences when she describes her interactions with WIC staff. So she describes her WIC nutritionist as very sweet. She calls us. She knows that we have a lot of kids. She'll call and say, oh, you have an appointment tomorrow. And I'll be like, oh my gosh, I forgot. Don't worry about it. We can schedule it for another day when you're free. She's always about us. She has great customer service, and she's very good with people. So this matters. When we interview SNAP and Medicaid beneficiaries, they have a very different experience with their workers. So this is from a paper called "It's Like Night and Day," which unit will send. They describe feeling stressed out and stigmatized in their interactions with workers. And a part of it is because workers have these different competing pressures that takes them away from personalized, tailored service delivery. What about using benefits? So after you've managed to get the benefits, so you successfully paid the learning, compliance, and psychological costs, now you have to actually go out and use them. And I call this redemption costs. And it can be really tricky if your benefit is super narrow and constrained, like in the case of WIC, where there's a list of foods that you have to purchase depending on your eligibility group and what the nutritionist has prescribed. And then on top of that, you have to figure out which store is going to be nice to you, essentially, which store is going to have WIC approved foods. These redemption costs show up in other programs like the Housing Voucher program. You got on the wait list. You finally have your voucher in hand. Now you got to go find a landlord that'll let you use the benefit. I finally paid the compliance costs for Medicaid, and now I have to go find a doctor. Same with the child care subsidy. I finally managed to get the voucher, and now I have to find someone that'll take it. And bad experiences when you're actually trying to use the benefit can deter long-term program participation, even if you're eligible. So you might say, for WIC, it's not worth it after the first year because I can't seem to nail the redemption process. It's really difficult to use it in stores. For the childcare subsidy, you might end up using neighbor care, family friend care, because it's just too hard to try to find a childcare subsidy provider that fits your work schedule. And we know we have some evidence about what people experience. So we know that there are negative sort of Section 8 or the Housing Choice Voucher program, negative program experiences with that. We've got some evidence about difficult retail experiences across multiple disciplines, and some evidence about the difficulty of finding healthcare providers and finding subsidized childcare options. And here are some hunches we have from the qualitative evidence about why third-party agents are challenging, or why these redemption costs emerge. And a part of it is limited monitoring and sanctioning of third-party agents. So it's difficult to know, or we know on sort of like an ad hoc basis, who bad agents are. So I'm sure for the WIC directors on the call, you know, like I don't want to say a troublesome store, but you know there's a retailer you've had your eyes on who isn't keeping stuff in stock, whose cashiers are giving WIC beneficiaries a hard time. But sometimes it's hard for agencies to know, and there's no real threat of consequences for poor redemption experiences. So sometimes retailers are monitored infrequently, or audited or monitored infrequently, and there's no consequence if they fail to provide an optimal retail experience. There's no monitoring for landlords. There's more of like a fire alarm sort of mechanism. You might raise a concern about a landlord, but there's no active monitoring of landlords who might discriminate on source of income or steer vouchers in particular properties. And then in addition to that, there aren't great incentives for third-party agents to engage in the redemption process. So program beneficiaries might not be crucial to the agent's bottom line. So we see this in the retail space. So if the WIC beneficiary, and I've heard this from vendor coordinators when they're sort of talking about retailers and the challenges with retailers. If the WIC population isn't crucial to their bottom line, they're less willing to invest in staying up to date with sort of the redemption guidelines, making sure food's in stock, making sure cashiers are trained, and that WIC beneficiaries are having a good retail experience. So those are some hunches about using benefits and what might emerge. I think I'm about done. Key takeaways. So low-hanging fruit, sort of not super like teched up, like I'm not talking about AI or anything like that. Just sort of things that we've heard in the field over the years about what makes things challenging for workers to do their jobs. The administrative capacity of agencies is crucial. You can advocate at the county and state level for additional administrative funds, since that's the level of government that's responsible, I should say, for that. So advocating at lower levels of government to expand and improve the workforce. And then shifting benchmarks to include incentivizing recruitment and retention of eligible families. Like, that's not how workers are assessed. they're not assessed at how well they've kept their cases. It's how quickly they process the applications and the research, right? So that involves advocacy at all levels for benchmarks that encourage good customer service as defined by the beneficiary. Am I out of time? I think I'm out of time. Okay. Okay, I'll end there. I'll hand it over to Don.
Thanks so much. We could go on about this topic for hours. And I just want to observe how terrific it is to have this sort of conversation, which I think maybe we would not have been in a place to have 10 years ago. Thanks everyone for all the questions. Some of us have been trying to respond as they're coming in. And I'm also going to start by asking the panelists what I think was the most common question that we got before we started, which is, what advice do you have about what public agencies can do to reduce burdens? And you can answer that at different levels. It could be advice to street level bureaucrats. It could be about how you work with third parties. It could be about how you take a whole of government approach to reducing burdens. And you've talked about some of these strategies, but if you were to pick one or two suggestions that you could implement, what would those look like? Who wants to go first?
Okay, I'll go
Elizabeth.
first.
Thank you.
So first off, I think we oftentimes assume that we understand the root cause of burdens, but we may not. And so one of the things that I really love that OES and other agencies that we've been partnering with do first is actually engage with communities. So actually going out, interviewing beneficiaries like Carolyn's done in a lot of her work, and surveying beneficiaries and trying to understand what are the key burdens first, right? It may actually be awareness. It may alternatively be compliance. And so then you can sort of tailor, at the very end of my talk, I was trying to think about how do we better tailor the different strategies and tools to the problem at hand. And that actually may look different for different communities as well. And so ultimately, what I would advocate for is sort of a bundled approach. So trying to both increase awareness, but then also provide some access to a helpline or personalized assistance that people can go to if they're also facing compliance hurdles. But one of the things that I think is really important about engaging with members of communities first is that, you know, in a lot of the qualitative research that I've done with folks who perhaps never applied to begin with, it's because they don't trust the government to serve somebody like them. And so by engaging with members of communities to begin with and try and understand where they're coming from, I think it actually perhaps could show them that their voice matters. And this is a really important, I think, first step before designing the sort of tools for burden reduction.
Meredith or Carolyn, do you have anything to add? If not, I'll move on.
Yeah, I can jump in real quick and just say I think, Elizabeth, that absolutely is very important. And I'm glad that various agencies and offices within the federal government are really starting to take some of this, lived experience expert work seriously, consulting the people who are most impacted by programs. Something that I was learning from Carolyn's presentation was, of course, and Elizabeth, you were just touching on this as well, is that how the experience, can differ so much from program to program, and just really the importance of when you are consulting people, of course, I talked only about Medicaid, but, it's important to think about this from the holistic perspective that people are often recipients of multiple programs or potentially eligible for multiple programs. And so really trying to, if you're wanting to figure out how to reduce administrative burdens for a specific program, I guess in general, I think you need to focus on specific programs and kind of take that approach. And then I mentioned this at the end of my presentation, but I think to the extent that there are ever any new national or even state level policies that are going to be affecting, the welfare state in particular, I think that kind of putting as much of the requirements built into the statute at the policy design stage of like, okay, you need to have states checking with other databases to figure out who's eligible so that folks don't have to provide documents, things like that. To the extent that that's possible, I think that the policy design stage is very important. Of course, we don't have many big policies often like the Affordable Care Act, but when they do come up, I think it's important to advocate to the federal government that those features are baked in.
Go ahead, Carolyn.
I was going to go in a very different direction. So Don, if you want to add on to that, I'll just save my comment.
So I was just going to add that some of you might be aware of the President Biden's customer experience executive order, as well as revised implementation guidance for the Paperwork Reduction Act. So those at the federal level offer the sort of top level government-wide, non-policy specific incentive to do work in this area, and have started to build out the toolbox of skills that people need. But then Meredith mentioned you have to match those tools to the specific policy problem. Carolyn.
So this is more of like a practice oriented for the program managers and the directors. Talk to your workers, not that you're not talking to your workers, that sounds really, really random, but me doing interviews with workers, ensuring confidentiality, and letting them just sort of get stuff off of their chest has been super helpful for the agencies that I've worked with, because a lot of workers are actually paying a lot of these costs that we talk about that beneficiaries are facing. Like they're breaking their backs to make sure that people are getting their stuff in on time. And so they have a good idea if you're looking for like agency specific, unit specific strategies on how you could support workers in ways that would reduce burdens for the applicant. They already know. So, and it might not be go hire another worker. It might be like, I need an extra 10 minutes for lunch. I don't know. It might be something different. It might be like, I need access to a training that I know my friend in another county is getting. Like they know exactly what's on their plate and what they need to be a better bureaucrat. And they're already pretty amazing. So I would actually figure out a way to do some sort of third party, maybe not a consultant because that costs money. But if you could find like a third party way of getting to know like what people are seeing and experiencing on the ground as workers, that'll give you a good insight on the kinds of targeted strategies you could use to make it easier for the worker and subsequently easier for the beneficiary.
One thing I'm very excited about in this area of research and practice is the combination of qualitative research and quantitative research, where if you've heard of terminologies like human-centered design, part of the emphasis is just on using ethnographic techniques to talk to clients, potential clients, observe them in practice, trying to interact with the system, or talk to your caseworkers, and using that knowledge then to inform and map onto other types of information you have about what might actually change the system if you had a chance to pilot new process change. We're running short on time, so I'm going to try and sneak in one more question and ask for quick responses. But we had one question about non-English speakers and then another question about immigrant families and what we know about their experiences of burdens in particular.
I can speak to that a little bit unless someone else wanted to chime in. I can speak from the North Carolina perspective. Oh, Meredith, okay. I can speak from the North Carolina perspective. Agencies are very ill-equipped to deal with immigrant families. And this is not new news to the managers here. I think translators are really important. I also think a very diverse workforce is incredibly important. Some of the translation services are basically, the applicant calling a translation line as opposed to an active translator being involved. It's even better if you have a Spanish-speaking bureaucrat that can help an applicant. I've seen some units organize their applications and their research around caseworkers that have particular language capacities, which I think is really helpful for applicants. So I'll leave it at that.
I'll add something that may seem pretty obvious, but I noticed it when I was actually looking at state Medicaid websites and their applications and how they've changed that over time is just having tons and tons and tons of translations of the application itself, or even the explanation of how the process works on the state Medicaid website. Again, I focused on Medicaid, but this applies to other programs as well. So there were some states that had, up to 20, 25 different languages available of their Medicaid application, and other states that had more like 2 or 3, English, Spanish, and then maybe one other language. So that's one thing that feels also like another one of those, low-hanging fruit.
So I'll just add that, in some of my qualitative work with students and families who are applying for means-tested aid for college, one of the key things that comes up over and over again, especially with income verification, is the fear that disproportionately immigrant families face whenever they're trying to get access to aid, because it requires parental income verification, and then that could potentially out their parent as an undocumented immigrant. And I think that we really need to figure out ways to help students and all clients, right, in this situation where they fear the administrative state, and actually train folks to be able to interact with these clients who do face this severe fear and stigma around their documentation status.
Yeah, well, I think we have some evidence about how immigrant or non-English language status is associated with higher learning costs and higher compliance costs, because dealing with the paperwork is more difficult, especially if you don't have options in your first language. But as Elizabeth points out, there's work by people like Jeremy Borofsky, who've looked at how the public charge rule discouraged people who would have been legally eligible simply because it created this climate of fear around accessing public services. We have about 2 minutes left, so I'm going to sneak in one more very quick question. People asked about the role of AI. What can AI do to reduce administrative burdens? It's the hot topic. Who's a hot take?
If people can afford it, because we have federalism, I would hate for somebody in Minnesota to have this awesome AI experience with a chat bot, a chat box and everything, and then somebody in, Kentucky is struggling, although it probably would be the opposite. Anyways, that's my take. Resources matter.
Resources matter, and I think that there are serious costs and benefits of using AI. One of the things that a lot of the federal government employees are thinking about is using AI for fraud detection, and there are very serious issues with doing that. Training data is biased. We have to recognize that. So it may actually end up creating a lawsuit for you rather than actually helping with fraud detection. So there are some definite benefits potentially, but there's also some serious costs that I think we need to be considering.
And I think we've seen some international examples of the use of algorithms that try to automate fraud detection, which massively backfired on the government and created legal liability and political liability. But everyone is super excited in many, especially tech spaces, about the potential use of AI, either for helping caseworkers or for helping applicants. But we're so early in this process that I think there's going to be a lot of churn of ideas and practices before we settle on a solution here. I think this is where I sign off. Judith, do you want to bring us home?
Yes, most importantly, I want to thank all of you, Meredith Dost, Elizabeth Bell, Carolyn Barnes, and Don Moynihan, for sharing your time, your experience, and your research with us today. As I hope you all saw in the chat, the information was really well received and people really appreciated it. Thanks also to Dawn Duran for handling the tech for the webinar. And as we mentioned before, we'll be posting the slides and the recording of the webinar within a day or so. And if you registered for the webinar, you'll receive a link to those by email. And we do encourage you to share those within your offices with friends in the field. We love to increase the reach of these resources. So with that, thanks to all of you again for joining us today, and have a great rest of your day. Take care.